Hi, this is Russell from BocaRaton.com. Today I am speaking with Laura Goodhue from the Florida Alliance of Planned Parenthood Affiliates. Good morning, Laura. How are you?
I am fine.
So I see that we have interesting news coming out again out of the state of Florida. Rick Scott just signs a bill to block thousands of Floridians from health care at Planned Parenthood. Tell us more about what's going on with Planned Parenthood in the state of Florida.
Sure. So, unfortunately, Governor Rick Scott did sign into law a bill that essentially defunds Planned Parenthood. It takes away health care from thousands of women and men in the state that depend on Planned Parenthood for high quality, non judgmental health care. We have seen an increase in these types of political attacks against reproductive health care for a while now. Planned Parenthood has been around for almost a century in this country, and 1 in 5 women has been to a Planned Parenthood provider in some time in their lifetime, and so it's unfortunate in our state when you see increase in new HIV/AIDS cases, the Zika virus, that the state, instead of focusing on expanding healthcare, the state has decided to focus on limiting access to contraception, cancer screenings, as well as testing and treatment for sexually transmitted infections.
Right. So from Planned Parenthood's, from their numbers for the state of Florida. So I think we should kind of put all this into context. So the total number of abortions that take place in the state of Florida is how many?
So in 2015, there were 71,000 abortions in Florida, according to the Agency for Healthcare Administration.
And from the U.S. overall population, how many people have had abortions in their life?
So there have been stats out there that demonstrate that 1 in 3 women will have an abortion at some time in her lifetime.
So 1 in 3 women in the United States of America will have an abortion at some time. So after this came to light yesterday, of course, Facebook blew up, and it was Easter, and I'm having Easter dinner with my family, and talking about all this, and my mom says I'm the third out of 4 children, and after I was born, my mom had a medical reason, to have an abortion. And, it was interesting having two sisters and my mom at the table, and both of them were basically like, you know what, it should be the woman's right to choose whether to have an abortion or not. And, it's their body. It's their, of course, women more likely than not are the caretakers of the children. So I was very curious in speaking with you about the number of abortions that take place in the state, and what happens if your services are unavailable. Who's going to take the lead in addressing unwanted children from these pregnancies if your services are unavailable?
So Planned Parenthood has been around in this country for almost a century now this year, and we will continue to provide they will continue to provide high quality care to patients. This law that was recently signed would take away funding for public funding that is meant for low cost contraception for men and women. In fact, Planned Parenthood Health Centers do a number of vasectomies through the Title X program, for example, for families that can't afford it. In fact, really, Planned Parenthood Planned Parenthood across the country, less than 5% of the care that they provide is abortion care. But at the same time, Planned Parenthood is very proud of that abortion care that they provide because it is a part of the full range of reproductive health care services. And so they are proud to provide that care, and yet this law is targeting preventive care services to prevent unintended pregnancies. In fact, no one does more as an organization in this country to prevent unintended pregnancies, not only through education, but also through counseling and information and education. And we start early with adolescents. Planned Parenthood has a strong program, throughout this country of providing that type of education to make sure that adolescents make healthy choices for themselves.
So let me get this straight for the listeners. So 5% of Planned Parenthood's budget goes towards abortions.
So it's the care that they provide in terms of overall services.
Uh-huh.
Nationally, less than 5% of the care that they provide is abortion care.
Wow. Wow. So it almost seems like maybe Rick Scott isn't completely abreast on exactly what maybe Planned Parenthood really does. I mean, could there be a is there some misinformation floating around that, that they really don't realize the true
Certainly, I mean,
mission of Planned Parenthood?
there's certainly misinformation, and we've seen an increase in that misinformation and hateful rhetoric towards abortion providers in general since last summer, when there was undercover videos that were released that was really a smear attack against the brand of Planned Parenthood and the patients and doctors. And we've also seen that because of this hateful rhetoric, we've seen violence against Planned Parenthood health centers and providers across the country. And it's really time to stop, because this is a trusted provider that women have been going to for a century now.
Right. So do you think, I mean, is there a way that this could be tied into maybe more of like how Care Resources out of Miami that handles a lot of the South Florida GLBT population, and they do give the free screenings, they give the medical care, and that's so well understood about going in to get tested to see what kind of STDs, HIV infections, and making sure that if you are infected, so you're not spreading it further. There's preventative care. They give free condoms. I mean, on and on and on. What Care Resource does out of South Florida, it seems that maybe it's the message that needs to get out to the people and say, well, hey, this we do 95% of these services, and you're focusing on the 5%, or maybe even a little less than 5%. So people that you see now, I think in the state of Florida, my nephew is 13 years old, and the topic came up about teen pregnancy in school, and he's only in middle school, but of course kids talk, especially with his older sister that's in high school. So if you talk about what happens to these kids that are unwanted, you're having these kids, you're being forced to have these kids, you don't have the money, the means to support them, and how much money it costs to raise a kid today. So I think even aside from the medical reasons, how would that financial burden take place if your services aren't rendered to raise it?
Yeah, I think it's really difficult to assess the impact, but we have seen in other states when Planned Parenthood is defunded. In one instance in Indiana, there was a significant, actually, termed in an outbreak of new HIV/AIDS cases in areas where the Planned Parenthood health centers were no longer able to provide that care. Texas, I think, is the starkest example, where they saw a 27% increase in Medicaid-funded births amongst women that received contraception from Planned Parenthood health centers. So, we can see the examples of other states. It's really hard to tell what will happen in Florida. But I just, want to stress that that Planned Parenthood provides the full range of reproductive health care services, and that includes abortion care. And so women need to have access to all of their options so that they can make the best decision for themselves in consultation with their doctor, without the interference of politicians who really shouldn't have anything to say in terms of a woman and her her personal private decisions.
I agree. It almost seems like yeah, government is encroaching on our individual rights of to choose.
Abortion, it seems like that is not necessarily a value. There have been a number of laws that interfere in this personal private medical decision.
I have to agree with you there. So now this is going to be, I believe it said it's going to try and come into law July 1st.
That's right.
What happens? So what could happen between now and July 1st to see if this can get some traction?
We raised some of the legal concerns, especially with this law. The law purports to end Medicaid reimbursements to Planned Parenthood. A number of our patients have Medicaid insurance, and Planned Parenthood health centers are then reimbursed for those services provided. So it's never a blank check. And so we raised those, legal concerns because these are actually a good portion are federal dollars, and so we'll see if that resolves itself. But in the meantime, we'll continue to be available in the community. Planned Parenthood has a health center in Boca Raton and Wellington and West Palm Beach and really across the state. So they'll continue to be there for their patients. It just may make it more difficult, in particular for very low-income patients, to receive the same types of services. However, Planned Parenthood takes all types of insurance. They participate in the Affordable Care Act marketplace and receive will take private insurance as well. So they'll just have to, continue to assess the impact on their patients.
Yeah, it says, I'm reading here, that in Florida, Planned Parenthood serves more than 67,000 patients yearly, including more than 11,000 Latinos. In Palm Beach County and Collier County, Planned Parenthood affiliates serve nearly half, 45%, of women in need of affordable contraception and publicly funded family planning health centers.
That's right.
That's incredible. That's incredible. So
from the Guttmacher Institute. That's right.
Yeah, those are incredible numbers. So basically, if this does go into effect and it's not challenged, how much overall budget would be affected by Planned Parenthood? Is that known yet?
So it's not so much the budget that's impacted, it's these patients and these long-standing programs. In Palm Beach County, we have a 20-year program with the county health department that serves adolescents with education, counseling, and contraception. So by barring this county health department that chooses to partner with Planned Parenthood from doing so, it is impacting that program and the thousands of teens that Planned Parenthood serves each year. So it is not necessarily the impact of the overall organization, but rather the patients that it serves through that program. So we will continue to strive to be there for the patients. However, this certainly is a hit for that program, and the organization simply has to figure out how they'll continue to continue providing those services.
And what are the other arms that you have at Planned Parenthood for raising money?
So Planned Parenthood does a considerable amount of fundraising, receives some grants, and as well as the health center revenue. We are a provider just like any other healthcare provider that accepts insurance, as well as self-pay.
Okay, so in other words, there is a for-profit arm to the health centers
No.
No.
Nonprofit organization. However, just because they're a nonprofit, they don't gain a profit, but they do generate health center revenue that then goes into the operating cost of providing care at an affordable rate.
Right. That's where I was going with. Sorry to clarify that. Anything else that you'd like to add to our listeners today?
I think that's it.
Okay. Well, thank you very much for your time this morning, and I'm sure your phone's going to be ringing off the hook, and Florida's going to have to get on board and see what we can do to make sure that this does not come into law July 1st. And I think we need to have a conversation with Rick Scott and unfortunately, I guess in the end, I guess everything does boil down to politics, and you have the Republican-led Senate in the state of Florida. I don't know how the Democrats felt about it. I didn't see any press releases come out, but we'll see if we can get more down and dirty. And thank you for listening. And this is BocaRaton.com signing off. Thank you so much, and we'll talk to you guys again.
All right, thank you.